All right. Hi, everyone. I am Jackie Dyke,
And I'm Susan Wilson.
and we're here today to talk with you, or to you, I guess, since this is recorded, about our presentation, which is Don't Farm It Out to Facebook, using your skills as a CTRS to design interventions that work.
And so, just to let you know, we're not in the same place, Jackie and I, and we're meeting online as we have throughout the pandemic. So, there may be some little glitches here and there, and we apologize, but this is all new to us as it's new to everybody else.
Yeah, so thank you for your patience. So if I can get the slide to advance, we'll get going here. There we go. So Susan and I both love both therapeutic, recreation, and social media. There's me. My favorite Facebook pages are pollinator friendly yards and crap wildlife photography, if you want a good laugh.
Okay, I've first of all got to check out crap wildlife photography, and that's my. These are actually both of our Facebook photos right now.
Hmm.
Mine celebrating Mother's Day, which was this past weekend. My favorite Facebook pages are the Aldi Isle of Shame, or as I like to call it, the Aldi Random Isle of Crap. But I like the Karen Free version. Cortland Eats and Treats, Cortland Softball, and Ginny Howe, who is my niece, and more importantly, the mother of my grandniece, who is the cutest baby ever.
All right. So for this session, we have three different learning outcomes for you all. Hopefully, after you do this video and practice the things we're going to give you throughout it, you'll be able to identify at least one strategy to identify new interventions for your population. You'll
And that
also, go ahead.
you'll be able to identify at least two benefits of using leisure analysis, or I'm sorry, activity analysis.
And you'll be able to identify at least one strategy to use social media wisely to improve your clinical practice.
So before we begin, I just want to tell you that every so often you'll be looking on social media, which I do most days, look on social media on the websites, and you'll see things that say, I have a group in 10 minutes. What activity should I do? And that makes a college professor cringe. So we are going to be sharing the names of, we're not sharing any names of any posters. We're not sharing anything about them that could give you an indication of where they're from. We're not trying to shame anybody. What we're trying to do is just talk to you about asking better questions and formulating a better outcome for your clients.
Yeah. So, we also don't want to critique the very needed supports that have been happening throughout COVID. We got the idea for this presentation pre-COVID days. So what we're really wanting to do is view this emerging reliance that we've developed on social media um, instead of using skills that we all already have as CTRSs. So um, we didn't know why we were seeing the kind of posts that we were seeing all over Facebook. Um, so we're gonna walk through, like Susan said, a bunch of like anonymized Facebook posts that are from different TR support web pages, and we're not making fun of these, but we want to talk about what what we could be asking instead of what we are asking. So, oh, here we go. Um, this is what we saw going on. There are CTRSs who are posting routinely to Facebook to plan out monthly calendars, to plan groups, often, like Susan said, at the last minute, like on their way to group, they're asking for help, figuring out what kind of interventions to use. But there was really important information that was not included in these posts. So, who are they serving? Like, who are the folks they're working with? Other than their age group, who are they as people? What outcomes was the CTRS hoping for? And what were their department goals, or what were the team goals?
So a lot of times it was just I need an activity, and that was the focus. But these are very key questions that we should be asking ourselves on a regular basis. And so this is just a way for us to kind of get in and look at some of these questions and how maybe to ask them a little bit better.
Okay, and so we do have several examples that we're going to walk through together. Here's what we saw.
I'll say this, that this one is interesting. It says, hi, everyone. I've worked with clients involved in justice system before, but they were also DD and in community group homes. At the end of the month, I'm going to be working with incarcerated teenage girls. So it'll be a big change. What's your favorite intervention activities, etc., to do in corrections? So Jackie and I were reading this and we're like, that's a big disconnect. So you're talking about doing activities in corrections instead of doing activities with teenage girls. And so having that conversation is important.
Hmm.
I've been told we've been allowed to garden, but that's my only idea other than sports activities. Please feel free to give me some ideas for additional sports and games.
So I will say one great thing here that I see is that they are open to additional ideas and they are not assuming that they know everything about their population. And coming from a point of I need help, like that's great. It's great to ask for help. Um, the things that we saw, like Susan said, that concerned us was, hey, we should we should probably look at this population as teenage girls. So what are commonalities among teenage girls who are, I believe are they Gen Alpha? Maybe part Gen Alpha, part still Gen Z, depending on where they fall on that teen spectrum. But what are commonalities among that group? How can we start there? Um,
Rather than looking at the facility or the setting.
exactly. So that might open up a conversation of a whole other things that could be done to really help these young women to move past this time and to gain skills where they wouldn't have to return later. Okay. Here is a really interesting one. I have a lot of defiant and disrespectful teenagers this week. And then obviously that emoji is communicating a lot of stress and heartache. Um, and I see this two ways. I totally understand that it is tough to take negative feedback. It is really hard sometimes to work with folks who who may be a bit rough around the edges. Um, but I think that in a way, this is also just describing a teenage population. Defiant and disrespectful are commonalities across all teenagers.
I live with a 13-year-old. That is a perfect description of a teenage girl.
Yes. So something to keep in mind here also is that if we are, you might be thinking to yourself, yes, well, that's, a typical or normative teen who is not at a facility. But keep in mind, if you're working with folks who are seeking behavioral health care, that their symptoms are behavioral. So this is actually super normal and to be expected. It's easy to say and tricky to do that we don't want to internalize what our patients or clients, what our folks, what they say about us. But remember that these are symptoms of why they're receiving our care and not reflections of us as individuals.
And I'll say this: I've been working with a family for last couple of weeks on a different project, and they have a individual in their family who has mental illness, and the mother of this individual consistently says that is the disease or the behaviors talking, not my child. So they separate those two things, and it really is a great way to look at that. That we're looking at an individual who is in crisis and what they're saying, as opposed to that person what they're saying.
Yeah, I love that take on that.
Mm-hmm.
Oh, this is a duplicate. Sorry about that.
Ideas for nursing home week. So ideas for who? For your fellow colleagues? Are you doing a nursing home week for clients coming in and you're looking for bulletin boards? Are you looking at for nursing home week activities to for your own clients, for their families? Who is it that you're looking for? And so it's just really not understanding what was it being asked.
All right. Hi, everyone. The day program I manage for IDD is moving to a larger, more accessible location. My executive director is giving me the opportunity to plan the layout basically from scratch. What kind of rooms would you recommend? Any other thoughts or ideas for the building would be appreciated. Thank you. So first thing I want to say, you obviously are doing something well if your executive director is saying you get to plan the layout. So you must be doing something right. So good job, anonymous person, on that. That's very exciting to see. But again, like we're missing a ton of information because there's so many resources that could help you with this, but we don't know what you're asking. Um, do folks, so we know it's a day program, but what are their interests? You know, what is the age group? Where, like, where do you live? Is this an urban setting, a suburban setting, a rural setting? Um, what are the things that your folks like to do? Um, do they also have some physical disabilities? We don't know enough about this population that you're serving to be able to give you really good feedback.
And what are the other things that need to happen in that space? So, is there meals being served? Are there other therapies that are happening in that space? So,
Mhm.
giving a little bit more information is really important.
Yeah, and also keep in mind too, will you have outdoor area and need outdoor storage? So I love that you're doing so well that you get to plan this, but with some more information, you can get some amazing feedback to make a really cool program.
Does anyone have any fun ideas for Easter activities for adults and or kids 5 to 17 in an inpatient setting? So this one again kind of confused us a little bit. Adults, is are we planning for families? Are we planning for a unit that has adults and a unit that has children? That's a huge age range, 5 to 17. What's your what's your span during that day? Do you have the whole day? Do you have an hour? Do you have, what kinds of things are you looking for? Um, yeah, that was our questions.
Yeah. And the other thing is too, remember that 5 to 17 is quite an age range. So meeting the needs of a 5-year-old in the same program as meeting the needs of a 17-year-old is going to be exceptionally difficult to pull off well. We also didn't know, like, are you looking for outcomes or is this just like an exciting time for families? So again, more information and we could give you, and I don't just mean Susan and I mean the greater therapeutic recreation community could give you better feedback and more ideas.
What are your favorite leisure education activities that can take 10 to 15 minutes? I'm struggling with limited time and I try not to do anything that requires writing for my inpatient psych adolescents. So we have a little bit of information there. We're dealing with individuals who are inpatient psych adolescents. Um, the time period is very short, and so we actually needed a little bit more a discussion about what your outcomes were. Were they groups or were they small activities that you were doing before something else happened? What kind of setup did you have?
Yeah, and if your time period is 10 to 15 minutes, the problem addressed in this post is that you're struggling with limited time, but the solution doesn't seem like it's keeping the time limited. So the real problem is the shortness of that group or of that intervention. And so instead of finding things that can fit, the better solution here would be finding ways to have a longer span of time. And so instead of finding short interventions that likely will not deliver the outcomes you're looking for in that time span, supports around how to advocate for longer time, how to demonstrate outcomes to advocate for longer time, um, justifying to supervisors and administrators what what growth they will see in the individual you're working with if you were to have longer time, demonstrating how you'd evaluate that, um, getting to the root of the problem instead of looking at the surface level here, um, could make a really big difference. All right, my student is studying for her test. What is your opinion on the difference between transdisciplinary and interdisciplinary and multidisciplinary? So this one caught our eye. A few people gave some answers, and we're not sharing those here. Um, but when we're studying for tests, and I'm assuming in this case it meant the NCTRC exam, these are things that have very specific definitions that are tested, and so they should really go to their course materials and learn them there. I would hate to see somebody accidentally give an incorrect response on Facebook and have a student study off of a Facebook response that was incorrect rather than their course materials that they had built up over the course of their degree program.
It would be great if the folks could offer some sort of feedback in terms of, hey, there's a really great definition of this on in Peterson and Gunn, or in Peterson. That's how old I am. In Peterson and Stumbo, or there's a place where you can get this information. And again, it really is critical information that students need to know, and so it's not really an opinion; it's a fact.
Exactly.
I'm a new community life director at a memory care facility opened 2 months ago, and I'm looking for game ideas, supplies, books, resources that anyone recommend I could purchase. Currently, we have like 2 board games and a few craft supplies, so any recommendations would be greatly appreciated. What a great opportunity to be able to stock your cabinets, and so really kind of getting in here and just talking about what types of things are you looking for, what types of outcomes again are you looking for, what's your population like, what do they like to do, all of those kinds of things are important.
Yeah. And also with memory care, a lot of the things that people were doing 10 years ago are really going to be aging out. So as we've had this generational shift as to who is in memory care, we need to keep that in mind too. Things that may have been appropriate 10 years ago, well, now you're not serving the greatest generation. Now you're looking at the silent generation and older boomers. So what's appropriate for those folks? What were popular things for those folks? How can we provide quality of life and, exciting and engaging leisure experiences for folks who were not in our care 10 years ago?
And
Um, Go ahead.
just I just going in and visiting interns, you hear a lot of things, you see a lot of things over the years, and what Jackie said is right. I remember 10 years ago listening to swing music and music from the 40s and 50s, and now we're listening to music from the 60s. So just trying to get an understanding of who is in your long-term care facility.
Yeah, absolutely. The other thing too that I'm curious about is are you looking for resources for a therapeutic outcome, or are these the resources for folks to use when they're not working with you, or is it both? So a little bit more clarity around when these things would be used and what they would be used for would be super helpful here.
That's a great question.
Yeah. Thank you.
What do you guys think would be an appropriate number of recreation therapists for a 100-bed psych facility?
That is a
That
big question.
that is a huge question. So, what kinds of activities are you doing? What are your outcomes? Um, how
What
are
are
your
common
groups run?
diagnoses?
Yeah.
Yeah. Are you doing one-on-one interventions primarily, or are you primarily doing group-based interventions, or are you doing both?
Do you have
What is,
outside activities? Do you have inside activities? Do you go out into the community? Are you looking in terms of transportation as well?
are there any state regulations on staffing particular to CTRSs? Or would CTRSs fall under a different umbrella term in terms of regulations and staffing? So there's so much to unpack here that really when we ask a question like this on Facebook, we're going to get different opinions based on the particular programs that individuals have worked in.
Mhm.
Um, if you are in the exciting position of implementing a TR program in a 100-bed psych facility and you're designing this, please reach out to folks who have done research in this field and can give
Mhm.
you some really solid feedback. Um, and, take everything that you get on social media with a grain of salt for this one.
And I think one of the other things, and you may have said this, Jackie, and I apologize, is just how is it set up? How,
Mm,
if you have 3 or 4 units, if you've split it up into 30-bed units, how does that look?
yeah.
That makes a difference is how it is set up, how the facility is laid out.
Absolutely. I honestly did not even think of that. The actual physical location. If you're 100 beds all on one floor, are your 100 beds in 5 different buildings that are 5 different pods that are 20 people each? What's going on? Because all of that physical distance would also have a huge impact on the appropriate number of staff.
Definitely.
All right. I want to do a music group with my residents on my dementia unit. I have various instruments, but have never done an activity like this before. What do you recommend? Any good songs to follow the beat to? Other ideas for how to provide these therapeutic interventions? So, this is actually a very good question. Um, Again, it's not quite enough information, just like what we discussed before. Um, but what we wanted to point out here was the example of how to help answer these questions. So, Robin, if you are watching this presentation, you are our TR Facebook hero, and we wanted to let you know that.
I
The
think, and actually, I would have loved to have had some hero music play right now, like Robin to the rescue. So,
Yes, we love how often Robin responds and just directs people back to what is the outcome goal? So what is the goal? Why are we doing this? And that's absolutely important. So I love how not only did Robin ask what is the goal, but she gave suggested goals, like here's what you could expect. And she really made this comment an educational experience for anybody who read it. So Robin, we love you.
thank you, Robin, for proving
Um,
a point.
yes.
And I think also the fact that Robin put in there, these are some things that you can Google. That's also a very good tip, when you're asking what searches did you do? Because a lot of times you're looking for something specific and you do, music therapy for people with dementia and nothing comes up. You might try music therapy for people in long-term care. What are some other searches that you can do? And I love that Robin also threw in a resource too. And this is one of the really big, powerful things about social media is that a lot of us are in facilities where we're the only rec therapists. We are alone and we feel isolated and we may be getting tired of our own ideas and we want to bounce some things off of other people. That's a perfect situation for
Yes,
social media.
absolutely. Okay. So now we're going to jump into this next portion. And the first thing we're going to talk about is understanding the population who we serve. So they're more than just an age group, right? So let's dive in. Oh, you might need to pause me and Susan for just a moment and grab yourself a piece of paper and a pen or a pencil because we are going to be asking you to brainstorm, to jot notes, and to do different things during this. Kind of like a substitute for when we would have group discussion during this if we were live and in person. So take a moment, hit pause if you have to, but make sure that you have pencil or pen and paper moving forward.
And if you want to text another CTRS and bounce some ideas off of them, that'd be perfectly acceptable as well.
Absolutely. All right. So when it comes to the population who we're serving, there's a few things to really consider. So first of all, what are their hopes? What do the folks who you're serving, what do they hope for? What are their hopes for outcomes?
What stands in their way? What barriers do they have in terms of a independent leisure lifestyle or a leisure lifestyle that is satisfying to them?
Yeah. And how are they similar to each other? Maybe beyond their population type. How are they similar? What commonalities do they already have?
So typically we talk about working backwards when we talk to students, and we say, you have an individual and they have dreams and aspirations. I remember a number of years ago talking to a woman whose only goal was to play pitch with her grandsons. That was her goal. She had experienced a stroke. And so working backwards from that goal and saying, what are the things that we need to do in order for you to be at that point? She needed she needed help with fine motor skills. She was having some aphasia issues and having difficulty recognizing symbols. So all of that comes into play. So working backwards from the goal, what is it that this person wants to do? And what are the things that are standing in their way?
Yeah. So, one thing that we also want to point out is that people don't leave their hopes behind when they become a participant in our programs. Um, they had hopes before, and they still have hopes now. And some things are going to be the same, like the same hopes or dreams across their lifespan, and some things are going to be about recovering. Um, and that every person will have their own unique hopes for their life. But there might also be commonalities in terms of hopes across certain populations. And we're going to go into some examples of those.
So yeah, I can't say that word this morning. There are barriers that are common across the populations that you serve. So stop and think, what is common for the people that you work with? What are their issues in terms of their physical skills, their cognitive skills, their psychological aspects, and also thinking about their environment. What are some commonalities within their environment? And really starting there.
Yeah. So this is actually going to be our first like take a minute and brainstorm moment. So take a minute and brainstorm. And this PowerPoint slide is going to stay right there. And we'll be talking to you in about 1 minute. Okay.
We're back from our 1 minute.
We're back from the minute. I know you missed us.
We were going to talk all through your minute, but we decided that wasn't a good idea. So
Yeah.
we
Yeah.
gave you a minute to think.
There you go. All right. So, other than hopes and barriers, how else are your folks alike? Do you work with folks who are all part of a similar population, like veterans from a certain time period? Do you work with adolescents from a certain municipality? So, sometimes recognizing other commonalities can go a really long way in programming. Okay.
And
Go ahead.
and I guess that's one of the things is everybody doesn't just put their life on hold. So we can look at things like, are they a parent? Are they a partner? All of those kinds of things are very important. So looking at the commonalities, which may not just be um, necessarily where they are, but their life space and what they are trying to accomplish.
Yes. I love that. So, here's our judgmental goat. So,
So
here's
every
our
time you think to yourself, "Am I doing a good job?" Put up the judgmental goat and see what they say.
So you just developed some knowledge about the folks you're working with. If you stopped and thought through those three pieces, you just developed some knowledge. Are we currently designing interventions based on that knowledge? So pause for a second, reflect. Am I doing that? Here we go. Let's talk about planning for the population that we serve. So again, now we're gonna do a little minute pause here, but you're gonna stop and think, how did you come up with the last intervention that you did at work? And then what was it based on? So it may be an intervention that you did 20 times already, but stop and think back to that very first time that you offered it. How did you come up with it? So you're going to have a full minute here to stop and think, where did it actually come from? And also think, what did you base it on? Like how did you decide that it was appropriate for your folks? So here we go. It's minute time. All right, we're back.
So how did you come up with it? And how did you visualize when you started out?
Yeah. Okay, so let's talk about, we're going to break into these three things again: hopes, barriers, and similarities. Um, and here are four just examples of population hopes that you might see. So commonalities you might see across a group of folks in terms of hopes. So maybe a hope is finding accessible and inclusive leisure. Maybe that's a commonality, like the folks that you're working with, they want to find meaningful, accessible, and inclusive leisure.
And
Do
especially,
you cover? Go ahead.
I'm sorry, Jackie. Go ahead. No.
I say, does your suite of programming teach this? At some point across all the different programs that you offer, do you teach somebody how to find accessible and inclusive leisure?
And that's a great commonality that we can find. If all of your folks are going back into the community, right? They're going to leave your facility and go back into the community and need accessible, inclusive leisure. That's a commonality. So make sure that when you're looking at these commonalities, that you look at every aspect that you can.
Yeah, absolutely. Um, Susan, do you want to do the next
Oh,
one?
sure. So enjoying the time that I have left. Do my services improve the quality of life, decrease symptoms of anxiety and depression? So, one of the things that we might look at is if we're working with people in memory care or long term care, you know, they may not be going back into the community. And so, how do I have a high quality of life for the time that I have left? And how am I able to use my leisure time to give back or to um, find meaning within my own life?
Yeah, absolutely. Also common in long-term care settings are depression and anxiety, right? When we're not going to cure that, but do our services help to reduce symptomology? That's a big deal for improving
Mhm.
quality of life. Enjoying leisure free from substances. If you work with adults who have a substance use disorder, very common hope is that they'll be able to enjoy life free from substances. So, do the interventions that you've implemented give those experiences? Do they give them a chance to experience leisure free from substances? And, do they include those supports? Do they teach them how to find those leisure experiences? Do they teach them the skills to be able to continue to enjoy leisure free from substances?
Definitely. And improving my strength and coordination. Am I creating a situation that will cause measurable change? Working with the OT and the PT and the speech pathologist to say, how can my programs also complement what you're doing? So, using recreation and leisure activities to help with range of motion activities, fine motor skills, gross motor skills, and really acting as a team with those folks.
Yeah, absolutely. We've also got designing for barriers. So there are going to be common barriers to leisure for your population. And what those barriers are, this can vary dramatically across population types. But what am I doing to help folks overcome the barriers they do face? So you guys are taking a minute here too to brainstorm common barriers to leisure experiences for your folks. So go ahead.
And if you've ever had me for class, you've heard me say that the job of a CTRS, for the most part, is to work yourself out of a job. So what are you doing to enable that person to have an independent leisure lifestyle? And how are you getting in the way? Because we do get in our clients' way sometimes.
Yeah. So take a minute, jot down your thoughts. We're back like magic.
I
So
feel
begin.
like a shock jock. And we're back. Um, sorry.
No, you're good. So along with what you just brainstormed for barriers, there's other things to keep in mind. So sometimes we think about the very obvious barriers to leisure participation, but there could be much more hiding below the surface. So there could be invisible barriers to leisure experiences. So what are things that are currently getting in the way of your folks having that independent leisure lifestyle that the average person doesn't see or doesn't realize, or that we may even be forgetting? So, what's going on? There's going to be something invisible there. Uh,
And I think one of the things to look at is not only the experience itself, but all of the experiences to get that person there, right? So not only the fact that that person wants to go to the Y to play pickleball, but how are they going to get to the Y, and how are they going to utilize transportation and all those kinds of other things.
Absolutely. And, can they afford transportation? Or maybe their day off to be able to go do that is Sunday, and public transportation doesn't run the same way on Sunday. So
Mhm,
there's oftentimes like systems level things that folks may not realize exist. That could be definitely an invisible barrier.
mhm. Definitely. The other thing is physical barriers, is how accessible are programs and services. So somebody wants to be able to do these things. Are they able to do them in the community at large? and beyond ADA requirements. So how do you deal with a very simple thing is how do you deal with snow in the wintertime? How do you deal with other environmental barriers that may not be there all of the time, but might be there part of the year? And looking at what kinds of things can you do to help that person get over those barriers?
Yeah, really good points too. And we even have to consider medication side effects when it
Oh,
comes to
definitely.
physical barriers. Yep. That just popped into my mind just then. I had forgotten about it till now. Um, we also have social and interpersonal. So are your interventions welcoming? Like, are they truly welcoming and not just physically accessible? So if you are out taking folks out into the community, um, have you planned to use welcoming spaces? So is it spaces that truly welcome and value the folks who you're bringing, or are they places that are just you have physical access? So think about how you're designing around the barriers that exist for folks.
Definitely. So we're going to take a minute to stop and think about, write down all the similarities in the folks that you're serving.
Yeah. So right here is this is not the disability type that we're asking you to brainstorm, but what are those other things that maybe you haven't even considered yet? So here we go. A minute. Okay.
And we're back.
And we're back. Thanks to our sponsor. No. So our not so secret weapon that we forget about so often as practitioners is activity analysis. So activity analysis, this is a valuable skill that will elevate your programming, and we're going to dive right into it. When
When
is the
was
last
the last
time?
time you did it? Sorry, Jackie.
Oh, go ahead.
We're like, listen, when's the last time you did
It's
it?
important. When's the
Uh,
last time you did an activity analysis,
and
folks?
and activity analysis is something that when we teach it in class, or at least when I teach it in class, I tell the students, we're going to teach you the long way. Eventually you're going to find your way to do it, your short way, your not, not cutting corners, but the most direct route for you. And so it's good to every so often step back and do the long way again to get yourself back into that habit, to see what are the things that I have forgotten.
Yes.
So, as you probably remember, there are two key points that you need to understand when you're looking at an activity. The first is behavioral requirements. Those are the skills that are needed by the individual to successfully and as independently as possible engage in activities. So the therapist will know what movements, what actions, skills, abilities, functions, and activities will the patient or the participant be required to possess. So you're not putting somebody in a situation where they're going to fail because they don't have the necessary skills to do that activity. And or that you're making that adaptation so that they can be successful. The other is the inherent characteristics, the essential part of the activity. I often think about inherent characteristics as, what do I walk away from this activity knowing? So if I walk away from playing a Monopoly game with my sister, I know, one, how to fight, because that's always going to have send a fight going, or I'm learning counting skills, I'm learning money skills, those kinds of things. The inherent characteristic, what specific attributes, properties, features, or qualities are intrinsically and inherently a part of the activity. For me, for Monopoly, it's fighting with my sister and being able to count money back as my father taught me to.
There you go. And I think that the interplay between these two things is very important. So Susan mentioned, with the behavioral requirements, that's where we can make those adaptations. Once we know what's required, we can adapt so that people can participate. But if we don't know those inherent characteristics, we might accidentally adapt away the things that make Monopoly Monopoly. If
Mm-hmm.
we accidentally adapt away the competition, it's not Monopoly anymore. We've created a monster then.
Monopoly is a monster, just FYI.
Yes, it is. delightful monster.
It is a delightful monster. So
So
go
go
ahead,
ahead.
Jackie. No, go ahead.
So the factors that are influencing the selection of activities, um, activities must have, I type out a direct relationship to the client goal. So there has to be a reason for the things that I'm doing. And it should, once I do this activity analysis, I can see like, hey, I've broken this down and I can see directly how it ties to the client goal. Um, Activities that focus, functional intervention activities should focus on the ability of that activity to help the client reach their goals rather than just doing the activity for the sake of the activity.
And I think that that's one of the things when you see a message that says, I have a group in 15 minutes, what can I do? That's activity for the sake of activity. That's activity as a use of time rather than an activity for the sake of outcomes. And that's really what we're trying to get at is activity has to have purpose.
Yeah. And I personally believe, and I'm sure Susan does too, that all leisure is therapeutic. And we
Mhm.
love when our folks get to participate in leisure. But just leisure alone is not therapeutic recreation, and it's not putting in input and expecting an output of measurable outcomes as a result.
There's a difference between functional intervention in the Peterson-Stumbo model and recreation participation for a reason, right? Functional intervention, although that person might enjoy that activity, they're getting some sort of benefit out of it that is mindful, that is focused. Recreation participation, they're getting a quality of life, they're getting benefits out of it that are far beyond just their disability.
Hmm.
So functional intervention and leisure education skills, I'm just repeating what I just said, should have a predominant characteristics that are related to the issue, skill, or knowledge being addressed. So what is it you're trying to get that person, that group or that person to understand? Activity characteristics are important consideration for the successful implementation of a program, and client goals should be able to place an activity in some context in order for them to see a useful application to their overall rehabilitation or treatment outcomes. Why are we doing this? And never doubt that debriefing is one of the most important tools that we have. We did this activity. How can you see this activity helping you in the future? And making that connection and having that meaning for the client is very, very important.
Yeah, and never assume, no matter how obvious it seems to you as the practitioner, that the person you're working with knows why. Always have that discussion. Always. I can. Sorry, there we go. Like it's not advancing. Ah. Um, Also keep in mind that, one activity or one session um, is not going to reach your outcome goal. That's not going to produce behavioral change. And it doesn't for anything. You don't go to one PT session and suddenly have improved range of motion. You don't go to OT and all of a sudden achieve all of your OT goals. So one session is not going to produce desired change, desired sustained change. Um,
Oftentimes we talk about making a sandwich with Swiss cheese, right?
mm,
And so if you're making a sandwich with Swiss cheese, there's going to be some holes in it. But hopefully, if you have enough Swiss cheese, which I love Swiss cheese and I put a lot of it on there, if you have enough Swiss cheese, every bite's going to have Swiss cheese, right? Every bite is going to have some of that outcome. And that's very, very important. It's not, as the students say, a one-off. We don't do one and then just move on with our lives. We need to do it several times in order to produce that change. And then the other thing is you need to consider what type of activities the clients will engage in when they have a choice. If you're doing things in an urban setting and this client is very into, you know, uh, hunting or fishing or those kinds of things, is that something that you should be doing? Should you be taking them somewhere where they're going to be able to do activities that they'll they'll do when they have a chance to do them on their own.
Yeah, and on the flip side of that, also consider what resources they will actually have at home.
Mhm.
So let's say you're taking somebody and you're doing horseback riding. Like that's wonderful. That's exciting, that's fun. Will somebody have access to that after they're done with your care? And how will that help them that they no longer have access? Will it hurt them? Will it not make a difference? Like what is the purpose of that intervention? But think about what will happen after.
And using your leisure education sessions to help with those kinds of things. So you did enjoy horseback riding, and here's some ways that you can horseback ride. Here's some cost, some measures that are more cost effective. So you can balance all of that really easily.
Yeah, and then you're going to program to the outcomes and the priorities of the folks you're working with. So it can be really easy to program to my priorities, but what is the priority of the folks who are receiving services? Why are they receiving services? Those are the priorities, not the things that I necessarily value the most.
So we're also looking at our client characteristics. What do our clients have in common, right? Their gender, their age. We're not trying to stereotype people, but we want to look at what are some commonalities in these areas: family composition, ethnicity, education level, religious orientation, financial condition. All of those things need to be considered when we're looking at programs. What are people going to gravitate towards later on?
Yeah. Yeah, and our participants should see that it should be obvious. We might need to still help clarify it, but it should be obvious to see the carryover value in participating in what they're participating in.
We also need to look at those resource factors, and that goes back to that question of how many CTRSs do I need in a 100-bed psych unit? The number of clients need to be included in the activity, the number of staff conducting the session. All of that has implications. How hard something is, what the safety concerns are. For all the programs, especially leisure education skill development, figuring out how long you have in a time, because we want people to learn and we want them to practice skills, but we will also want them to enjoy skills. So if they just learn a skill, they're much less likely to use it when they leave you than they are if they learn it and start to do it enough to enjoy it. Oh, I
Mhm.
really enjoyed that activity. I'm going to pull back from that, right?
Yeah. And that's like too much equipment or highly specialized equipment detracts from the focus on the treatment goal. I kind of think about my kitchen in this way. Like there are so many cool kitchen gadgets I could get, but they only have a very narrow purpose and I can't use them universally. Does that make sense?
Yes, it does, because that's why I didn't want an Instapot, but then when I bought one, I wanted it.
Yes. Oh, I like my Instapot.
I
It
know
makes me
you
kind of happy. I should be using it more right now.
do.
All right. So we are going to have you guys do an activity analysis. So think about that most recent intervention that you did. We asked you about it maybe 10 or 15 minutes ago. We said, what was the most recent intervention that you did? Remember, and you had a minute to think about it and think about where you got it from. Now you're going to do an activity analysis on it. So you're going to get a full 5 minutes here. Um, but here's what we want you to do. Does the intervention actually provide, you're going to do the activity analysis, and then we're going to figure out, does the intervention actually provide an opportunity to work towards the outcomes that you are aiming for? So we're going to use the activity analysis rating form that's from the Leisure Education Manual 1, a Manual of Activities and Resources. It's the second edition, and it's by Stumbo. So this slide is up for you guys to use. Please actually write down your thoughts. So write down the name of the activity, answer the 11 questions about the physical aspects of the activity before you've adapted it, the social aspects, the cognitive aspects, the affective, and the administrative aspects. So stop and actually work through this. And you may have adapted and changed the activity since you found it, but go back and think about like that intervention in its purest form before you ever adapted it. Take 5
Exactly.
minutes. And we're back. That was a great 5 minutes. How was that 5 minutes for you, Susan?
It was, you know what? I got so much done in that 5 minutes. One of the things that you need to realize when we're doing this is that these are our tools. If you went to a pharmacist and the pharmacist just knew how to count pills and didn't have any understanding of the chemical compounds, how things interact, and all of that kind of stuff, that wouldn't be a very good pharmacist. As a recreation professional, you really need to understand the basic components of your activity. These are our pills. This is our way of providing healing. And so really looking at an activity and really analyzing is very, very important.
Yes, I entirely agree with all of that. Um, I do recognize too that in practice, sometimes we get busy. We get really busy. A lot of us, we're alone. We're the sole CTRS in a program or on a floor or in a unit. Um, and this is often something that we think can get put to the side. And understandably, there's nobody checking to see if we do our activity analysis, right? There's not a clinical supervisor coming along and saying, did you do an activity analysis before implementing this? But perhaps there should be. So, Susan,
Perhaps.
perhaps
If you want to send it to Jackie or I, we'll grade it and send it back to you.
we would love to give you feedback. Um, But in all seriousness, like this might be a great time for you. Just once a like pick one of your interventions, pick one of your groups a week and do an activity analysis. You don't have to solve the problem of missing activity analysis all in one day. But it is a realistic goal that you could work towards. So figure out, what are you doing and do this activity analysis and then really ask yourself once you've completed it, this last question that we asked, does the intervention actually provide an opportunity to work towards the outcomes that you're aiming for in your program? If
And
the answer,
having,
go ahead.
oh, go ahead. No,
So
go
say
ahead, Jackie.
if the answer is yes, awesome. That is great. But it very well might be it's not. And that's
Mhm.
okay too. Now that you know that, you can either adapt the activity to bring in the content that you need, or you can design something new. Okay? You are creative and able to do this.
And I think that one of the things that we really need to understand is that we as professionals kind of get in ruts, right? We always get in ruts. Teach the same thing the same way. You use the same examples, those kinds of things. So if you can mix it up a little bit and say, you know what, I usually use this for fine motor skills, or I usually use this for socialization. Let me try a different activity. Now you have a toolbox. And we are acknowledging, and I'll to be very genuine about this, we are acknowledging that you're overworked, that you've got a lot on your plate, that people continually throw more things on your plate. But
Mhm.
getting back to those basics also has a refresher quality to it. To be able to say, this is why I enjoy therapeutic recreation so much, because I can see this benefit in these very meaningful leisure activities.
Yeah, and also it's very exciting to be able to improve our programs and get better outcomes. It is so exciting to be able to walk into an administrator's office and say, "Here are my improved outcomes as a result of my work. Here you go. Here is the evidence that what I do matters." That is an exciting and empowering place to be. All right. So we're going to pop along now away from activity analysis and talk to you again about social media. We're tying it back. It all ties together.
And
Um,
social media is not a bad thing. As Jackie and I said before, we love social media. In fact, during the pandemic, I think we talked more on Facebook to each other than we did in any other form. It's a very good tool. It keeps us attached to our alumni. It keeps us attached to other NYSTRA members. It keeps us attached to our field in a very meaningful way. So we're not trying to bash asking for help in social media at all. And this cow is not judgmental.
yeah,
It's
this
not
is a
like the goat.
non-judgmental cow.
Yeah.
Does not compare to that goat from earlier. So here's the thing. We all have unique knowledge and unique skills, right? We're all individuals just like our participants are. So it's time to start um, using social media to share that with each other. So let's here's a fun quote. Knowledge shared is knowledge expanded.
Yeah, somebody
Jackie and
famous said
Susan.
that. Somebody famous said that.
Ah, it's us.
It's just us. We just say it.
But it's true though, like you are developing knowledge. You know, you just did an activity analysis. Um, you've developed knowledge around the intervention that you did. You know if you can expect certain results from using that as an intervention, share that knowledge. There's no reason that you have to keep that knowledge siloed. Oh, siloed. That was a farm pun, and I didn't
Oh, you
even know
should
it.
have had a silo, Jackie. You missed a great
What
opportunity
was I
there.
thinking?
I don't know. I don't know.
All right. So here is we have a couple examples of Facebook posts that we actually loved and we think are great examples. So here's this first one. So, hello, has anyone adapted a watering can or spray bottle or purchased one for gardening purposes for individuals with limited range of motion? This is a super specific question. Like I know that you need something um that's like you gave me all the information I needed to be able to answer this, right? So I know that it's for people with limited range of motion. I know it's not for some, like I know why they need the adaptation, so that can help me in saying yes, I have a similar tool or I have found a similar tool. Um, so it's just a great question. It has so much. It's not like paragraphs, but it has everything that we need to be able to provide answers.
And everything that we need to be able to provide an answer that works for you instead of adapting a watering can or a spray bottle for something else, we're using it specifically for the population you're looking at.
Exactly.
I like this question. We're looking for examples for documentation after an intervention. I've been doing notes for 2 years and I'm starting to doubt myself or might be feeling burnt out with again an emoji that just breaks your heart, right? These are things that oftentimes we feel, and again you're alone, and I know the last year has been particularly hard on most rec therapists, and things that you've been doing, and yes, you can question yourself, you can question whether or not you're doing something as it should be done or if there's a better way to do it. You have your own academic background, you have your own internship, you may have had 2 or 3 jobs where you've worked other places with, but there's no shame in reaching out to other people and saying, am I doing this right? Is there a better way to do this? And I love that last part, or I might be feeling burnt out. It's an opportunity for us to open up to other people and say, this job is hard and I could use some support.
Yeah. So I want to say, yes, you probably are feeling burned out. That's super normal. And it's actually more common the newer you are to the field because you haven't adapted as many coping skills yet as people who've been around for a while. Sometimes we think folks who've been around for a long time, so they're burnt out, but it's actually the newer professionals who are more likely to experience burnout. Um, and I also want to say, good job for not quitting documenting.
Right.
Good job for not saying, I haven't been documenting. Good job for doing your notes for 2 years and not just stopping with your documentation. So don't forget that documentation is part of the TR process, right? It's we document everything we do. Um, so please remember if you respond that you're not revealing any protected health information if you're sharing examples of documentation. And this is also a great chance to speak with your supervisors about what kinds of documentation would best describe outcomes. Okay, so one bit of information that would help is what kind of population are you working with and what are the outcomes you're looking to track. But we particularly loved that you haven't quit documenting, you're still trying, and that you are sharing that you're experiencing those feelings of burnout. Burnout something where, speaking with a clinical supervisor, if you have one, is super helpful. And if you don't, finding somebody who you can develop a mentoring relationship with is very helpful.
And I'll just say one thing because I want to speak to those folks that are. I'm going to get my 30-year pin this year for CTRS. So I've been a CTRS for 30 years, and Jackie said it's the younger ones that have burnout, and I understand that. Just because you've reached the pinnacle where you've gotten your 20-year pin or your 25-year pin doesn't mean that you're not susceptible to burnout.
Oh, right.
and and really having new and fresh voices come in and say this is what I'm doing is really going to help you. And so those of us who are a little bit have a little bit more time in the field, don't think that you can't learn something. And I'll tell you this: I am somebody who has new colleagues that have come in the last couple of years. It's changed a lot of things about how I do things, and it's made me a better practitioner.
Awesome. All right. So we made a Facebook farm. So I know we said don't farm it out to Facebook, but then we thought about, um, there are some things that Facebook can be super useful for in improving our clinical practice. So as we just emphasized in those last couple of slides, like knowledge, share that knowledge, seek the knowledge of others. It is a great place that we could use to build our knowledge.
And that idea of creativity, when something works, share it on excitement or on Facebook. Share your excitement so that you can say, "Hey, I did this activity. It really worked. This is the outcomes that I had. This is what happened," and it may spur somebody else on to do that particular activity, or it may spur somebody on to give you advice on how to even make it better. And isn't
Yeah.
that our goal?
Yeah, absolutely. And sometimes it's easier to share the negatives, but we want to share those positive, exciting things because it's almost like the creativity bug. Like if you're willing to try something new and experiment and see your outcomes, maybe I'm willing to try something new. Maybe it normalizes the risk of implementing something new again.
And I can tell you, as a college professor, we point our students towards Facebook all the time and tell them to join these groups. Giving those students those real life examples really ignites their passion and their energy for the field and makes us all better. So, sharing that creativity is just such an important tool, not only for yourself and your fellow practitioners, but for the future of the profession as well.
Yeah. In terms of development, you can use Facebook to develop yourself as a clinician. So there are some pages where you can actually find a mentor, but you can develop relationships just through comment section. You can find somebody who could mentor you, who could give you feedback and help you become your best. So they could really give you some honest discussion and honest feedback as to how your programs are going. Um, and not everyone, unfortunately, gets clinical supervision in their work setting. So this would be a great way to reach out and find somebody who occasionally can provide that clinical oversight to help you improve your practice.
And remembering that development is a two-way street and both has benefits. So, mentoring someone and having someone mentor you. So, making sure that you have those relationships of people that you can go to, but the people that go to you as well, so that you can share your knowledge.
Yeah, we recognize for our participants, right, that everyone needs a chance to give of themselves. So we need to give of ourselves too.
And then finally, support. We can reach out to other CTRSs who can support and build people up during the hard times. That's one of the things we said. We submitted this for the 2020 conference, and we had no idea that a pandemic was about to hit us when we submitted it. We have seen such good examples this year of rec therapists reaching out and talking to each other, giving each other encouragement, understanding what's happening at your own site and how you can better serve your participants. All that support has been so critical. And one of the reasons that healthcare has really become superheroes during this time is that we've not only been supporting each other, or excuse me, not only have we been supporting our clients, but we've been supporting each other. And that's a really, really important thing to do.
Yeah. I've been very proud to be part of this community. over the course of the last year. It's been super awesome to see how willing CTRSs are, just to lend just that, emotional support even. Like, I don't know you, you're practicing in a different state sometimes. I've never worked with the population who you're serving. You have different regulations than I've ever known, but I hear you. And I love how CTRSs have come together and done that as a whole.
And reaching out to tell people that they're not alone is the most powerful tool that we have during this time.
Hmm. All right. So thank you for being willing to um, sit here with us for the last hour and a half or so and dive into your programming and looking at one of your interventions critically. Thank you for doing an activity analysis. Um,
Thank
yeah,
you. Yes, and thank you so much for wanting to be a mindful professional. That's really a important quality that we have. Jackie and I have included our emails. Reach out. We're both at Cortland, teaching at Cortland now, but we have opportunity. We'd love to have an opportunity to share with you if you have issues or need support in any way. I will echo what Jackie said. I mean, this has been a tough time, but it's a very amazing time to be a recreation therapist and a very proud time for us to be a recreation therapist. So thank you so much for all that you do.
yeah. And thank you to Nystra for hosting us.
And hopefully next year we'll all be together back in Saratoga Springs.
Yes. Bye, all.
Bye all.